few different stretches that you can do to help alleviate lower back pain or stiffness. There are also great stretches to add into your everyday routine. Now, a couple of things to keep in mind for your stretching. You are going to determine how long you hold each stretch. I definitely recommend holding stretches for at least 20 to 30 seconds. Try not to bounce when you're stretching. You want to hold the stretches. You also can hold stretches from anywhere between 1 minute to 3 minutes. It really depends on how it feels and what your time allows. So what I'm going to show you is a few different series of stretches that you can move through. Now you can choose to do them all together like how we're going to do, and then you can go back and repeat them all again. Or you can do the same stretch a few times in a row if you prefer to do it that way. Now everybody's different, and just because one stretch might work for you, it might not work for somebody else. So use your best judgment. If something doesn't feel good or if it's painful, please make sure to stop. All right, so we're gonna start down on the floor and we're gonna do a child's pose. So I want you to start on your knees, separate them about hip width distance apart. Bring your hands to the floor in front of you and then push back through your hips and through your glutes to slide them back. Now, if you can, rest them on your feet and then rest your forehead on the floor in front of you and extend your arms. Now, for some of you, that might be easy to get into, but for others, it might not be. So, if you have difficulty, you can prop yourself up on a block. If you don't have a block, you could use a sweatshirt or a stack of towels. And again, try extending the arms forward, or if it's more restful, bring your arms to your sides and try to relax. And as you're breathing, big deep breath in and then breath out, allow the space in your hips to expand. Speaking of which, if you need to take this wider for a little bit more comfort, feel free to do that. And again, big deep breaths in and then breath out. That's your child's pose. The next stretch that we're going to do is called knees to chest. So lay flat on your back, start with your feet flat on the floor and your knees bent. Bring your right knee into your chest, hug it in. If this is too easy, extend that left leg down to the floor. And if you want to enhance that stretch a little bit more, you can go ahead, lift your head and shoulders up off the floor, bringing your chin to your knees. If that doesn't feel good, return back to this position. And then you want to go ahead and do the exact same stretch on the opposite side. You can hold that one for anywhere between 1 minute to 2 minutes or whatever feels good to you. The next stretch, again, begin flat on your back with your knees bent. This is your piriformis stretch. You begin by taking your right foot, crossing it over your left thigh. Maybe just leave it here. Now, if you want to increase that stretch, you're going to cradle this right leg, right hand underneath the knee and outer thigh, left hand by your ankle, and hug that leg in towards your chest and across your body. As you do that, you'll feel your glutes stretching right through here. Now, if that is too much of a stretch, just release the pressure. You can also choose to take that leg and extend it down straight to the floor, just like the stretch before. And again, if you want to intensify that, you can feel free to lift your head up off the floor, but it's not necessary. And again, hug and cradle that in. And then release it and do the exact same thing on the opposite side. While we're here, another stretch that you could do is really more of, less of a stretch and more of a movement, and it's called your pelvic tilt. So feet flat, knees bent. Draw your abdominal muscles in, and first be mindful of the space that's created underneath your lower back and the floor. So pull your belly button in towards your spine and bring your pelvis to the floor to eliminate that space. And lift butt up off the floor. And then release and allow that space in that little arch to happen again. And then contract, pulling it in, and again, your glutes are engaged, your hips might raise a little bit, and then pull back down. And you can choose to hold each of these for anywhere between 1 to 5 counts, and repeat that maybe anywhere from 3 to 5 times, and count that as one round through that stretch. Okay, the next stretch that we're gonna do, come on up to a seated position, slide your hips and your glutes back, and extend your legs out straight. Take your right foot, cross it over your left leg. Take your left arm, hug that right knee in towards your chest. Take your right arm behind you, and you can either stay like this, or you can turn and start to twist. And you'll feel that stretch through your glutes. You can feel it through your outer thigh. You'll feel it through your lower back, and maybe even your sciatic nerve area, your shoulders, and release it. Now, if you want to enhance that stretch a little bit, there's some neck rotations and head rotations that you can also add to that, where you turn and look as far back as you can, and then come back to the center, keep repeating, or you can even come to a look up, look down. Okay, the next stretch that we are going to do is our cat-cow. So I want you to go ahead and come to hands and knees. Separate your knees, natural hip width distance apart. Take your shoulders, line them up over your wrists. You can either have your toes turned underneath or down. Take a big deep breath, look forward, lift your chest, and then breath out, round it up. And again, you can choose to hold this for maybe 1 to 5 counts, and then release, using your core strength, drawing the belly button up, hold, and then release. Okay, and again, with that, you could choose to do that maybe 5, 6, 7, or 8 times in a row. All of these stretches can help alleviate pressure in your lower back area. Another stretch that's a bit more advanced, and it's the final one that I'll show you, is called Sphinx pose. I would only recommend doing that if you didn't have any problem with any of these. You're gonna lay flat on your stomach, and I want you to line it up so that your shoulders and your elbows are lined up. And you're gonna go ahead and draw your pelvis to the floor, squeeze your glutes, take a big deep breath in, and then breath out and lift up. And as you lift up, your shoulders should be stacked in line with your elbows. Now, contracting your glutes and pulling your pelvis to the floor, you're controlling how far up you lift, and you're controlling the degree of which you're able to strengthen, hold, and raise using the muscles in your lower back. That one can be very advanced. So only attempt that if it feels good. If you feel pain, you should come back down, and maybe you just start here and you don't raise up as far as I did. And again, regardless of which you chose, come up and hold for maybe a 5 count, and then release. So each of those stretches, I showed you 7 in all, are meant to help strengthen your lower back and to also release some tension. A couple of modifications, if those seated positions didn't work for you, here's a couple of alternatives. So your knee to chest, that was the one where we laid flat on your back and you literally brought your knee up into your chest. You could sit at the edge of a chair and bring your knees up into your chest. The piriformis stretch, you could do that. That's the one where you lay flat on your back and you cradle your leg, sit on the edge of the seat again, cross your foot onto your thigh, either leave your leg here, maybe you can even cradle it up and hold it into your chest, or you could extend your arms forward and then lean forward. Now, forward folds are tricky, so if that doesn't feel good to you, eliminate that and just stay here. Another variation would be for your seated spinal twist. That's the one where you sat on the floor and you had a twist. Same thing, sit up nice and tall, cross your legs, place that opposite hand on top, turn and twist into the direction that you are looking, and only hold that for as long as it feels good to you. And release it. So there you have it, some common stretches that you can add into your practice or do if you're experiencing any lower back pain or tightness. And again, please remember to check with your physician if any of those become problematic for you, and make sure that this is in fact something that's okay for you to do. If you have any questions, feel free to reach out. I hope that was helpful.